Assalamualaikum and salam sejahtera everyone. This is PHM 733 and 734 Clinical Clerkship 2 and 3 briefing for all assessors or supervising lecturers. Alright, okay, so I would like to represent myself as the course coordinator for PHM 733 and also Dr. Nur Kasihan Ibrahim for PHM 734. And these two clinical clerkship will be offered for this semester with a total period of 8 weeks. These are the learning objective of all clinical clerkship courses, which is similar to the previous semester. Well, for PHM 733 and 734 for this semester, we will combine instead of doing it separately. Supposedly, the first 4 weeks must be done for PHM 733, while the remaining 4 weeks will be for PHM 734. However, we have some issue with the availability of one of our clinicians. Therefore, we have to combine all the rotation in a total of 8 weeks. Well, if you look at the clinical clerkship rotation here, you can see that we will begin on 19 May and then we will end our clerkship on 11 of July, which will bring us to a total of 8 weeks where week 9 will have 2 weeks separate dates, which are week 9A will be around uh, 26 to 30 May, while week 9B will be 2 to 6 June. And please be informed that this week 9 consists of 2 weeks because of the recent changes in our PH 777 academic calendar. So in this case, we still have 8 weeks and the rotation will go accordingly to the table that I have presented here. If you look at the cost separately, you will see that the rotation is actually similar to the one that we have combined in the previous table. Similarly, in 734, we will have this rotation with empty boxes, which serve for the other clinical clerkship rotation. While we have 13 students as in the previous semester, however, we only have probably 10 students to do it full time at HASA, while the remaining 3 will do their clerkship in either HASA or in their remote hospital. So the 3 part-time students will be Tuan Nur Azwani, and then we do have Radia as well as Ashraf for this kind of mode of study. Apart from the clinical rotation that you have been assigned throughout 8 weeks, you also will be invited to our fortnight case presentation on every probably around end of each rotation, usually on Friday or Thursday. Based on the table that I presented here. So the first clinical flagship case presentation will be on 30th May on Friday from 8:30 to 5:30, and the supervisor or the supervising lecturers or assessors involved will be based on the each clinical clerkship course code, okay, which are presented in green or yellow boxes. All right, okay, so what are the requirements for these two clinical clerkship courses? First thing first, this is a little bit different from the previous semester. However, 733 or 734, they are identical. So if you look at the assessment that required for this course will be clinical activities consists of bedside assessment, PWDT, and then for presentation, we have presentation for fortnightly case presentation as well as bedside assessment. And then we also have portfolio and logbook, which consists of case report. And finally, we will do case. We will have viva for each clinical clerkship course code on July where all supervising lecturers will be the assessors. And bear in mind that for this semester, our BSA or bedside assessment will start to assess a specific skill uh, on our students. The skill will be related to clinical pharmacy or pharmacy practice, but not limited to Naranjo, ADR, probability scale. It could be drug interaction probability scale, or you can all assess a student on their techniques on using certain devices as well as how they do drugs dilution. So it can be any skills related to pharmacy that can be assessed on our students. Right, okay, similarly, for 734, as I mentioned earlier, the continuous assessment will be similar and the weightage will be identical to the 733 clinical clerkship 1. All right, so what are the requirements that needs to be fulfilled by our student? Well, for most cases, they have to clock at least 10 active cases. Well, we do receive requests to use retrospective cases, which is acceptable. And if you look at the distribution for each course, they are similar, and the final assessment, which is Viva, will be provided by RP. So that will be another invite that will be sent to all lecturers for um, attending the session as assessor later on. All right, okay, so to get a better view of the weightage as well as the assessment method, so this will be a much more informative as compared to the previous table. So you can see that bedside assessment will carry 5% each, okay, for each rotation, uh, while we know that for each clinical clerkship course it carries three different rotation where we already assigned that critical care will be the main clerkship, while for 734 the main clerkship will be infectious disease. The other two, which is in 733 endocrinology and gastroenterology, they are just a small clerkship because each rotation only lasts for a week as compared to the main clerkship, which usually will be 2 weeks. Similarly, in 734, neuro and oncology will be the small clerkship, so they will be combined in order to give contribution to each assessment method. So how do we select the case? Well, student will be advised to take the active case, as I mentioned earlier. Well, we do accept retrospective cases whenever we have limited number of patients during the rotation. And of course, we already reminded the student to use any case that probably will have some sort of complexity so that it will be suitable for postgraduate levels. This is just a suggested schedule for the whole week of a clinical clerkship rotation. Well, you don't have to follow exactly on what will be the things that you want to assess for our students, but this is just a guide so that you can better prepare or plan your weekly schedule so that it can be suited well to your routine or your teaching and learning activities. So about the My ATP, we assume that you can spend at least 1 hour for weekly discussion for each student. And this is also similar for clinical discussion, bedside assessment or presentation. And for the case presentation and Viva, that will be based on the course plan or the schedule that we will share later. All right, okay, so just to remind everyone that uh, online mode will be accessible for our part-time student, particularly Mr. Ashraf, Ms. Radia, as well as Ms. Tuan Nur Azwani. And for these three part-time students, you can always go online where you have to record and provide a link to the students so that they can access to the session. So as I mentioned earlier, two of them will be doing remotely, while Ashraf will do it in Hasa. So they can plan accordingly, and they can always update the respective supervising lecturers about their session whenever the assessment needs to be done. These are our clinical preceptor or clinician. We do have support from our Jabatan Pharmacy HASAP, and the pharmacist liaison officer is Miss Nurul Shahadas Fuad. However, for each course, we do have different clinician. For example, for 733, we have Dr. Fatima for endocrinology, and then a group of critical care clinicians, as well as Dr. Rafis for the gastroenterology. Similarly, we do have ID for 734, Dr. Rosnida, and then Dr. Shalini, as well as Dr. Nur Azura for neuro and oncology, respectively. So these are the role of clinical preceptor. They basically will provide all the case, and then advise our student on the case that they are discussing during work around, as well as probably will have in terms of suggesting the case to be presented to supervising lecturers. These are the role of supervising lecturers, and as I mentioned earlier, we do have the assessment to be completed, and of course we have to provide feedbacks whenever we do assessment, and during the time of clinical clerkship you will be invited to a fortnightly case presentation on every Friday or Thursday, and as well as the viva assessment, which will be on 8 and 9 July 2025. Again, we will do have a short briefing about how to uh, prepare PWDT for our student on the first day of the clerkship. So at that time, we will share all the information how to perform excellently in preparing PWDT, because that is actually one of the requests by the student. So that will be kind of orientation for this semester. To sum up, we do have four main assessment method. The first one is clinical activities, which consists of a bedside assessment and PWDT. And for presentation, we do have case and bedside. Student needs to submit portfolio and logbook, which consists of case report together with all the attendance record that they have to tick on every day of the clerkship. And lastly, the viva, which is the one that I would like to highlight here. Okay, so for the Viva, this is almost similar to the format that we had in last semester. And for this semester, we will do it in a similar location, which is TEC at FF2. We will utilize our computer labs for the student to access all the internet, as well as to prep before they come into the Viva room. So we have proposed, and in fact, this has been decided to be done on 8 July for 733, and on the second day would be for 734. So we will send back an invite, okay, for all supervising lecturers to be assessed on these two Viva dates. Okay, so please mark or uh, save this date in your calendar so that you won't miss any of the information. Well, that's all about the two clinical clerkship for master student on this semester. And if you have any question, please feel free to ask any question or inquiries or concern to both of RPs. Probably we will combine our WhatsApp group so that it will be serve a smoother communication platform. So please let us know if you have any question. And with that, I thank everyone for your kind attention.